Now, joining us live in NC Continental Prime this evening is Dr. Olusegun Salawu, a medical practitioner at the 44 Nigerian Army Reference Hospital in Kaduna. Thank you very much for joining us, Dr. Salawu.
Thank you for having me.
Now, Dr. Salawu, about 2.5 million people fell ill with tuberculosis in 2016, and one wonders why this disease is prevalent in Africa. Could you shed more light in relation to this year's theme of investing to end TB, save lives?
Yeah, thanks for having me. The issue of TB, as we all know, one of the factors that are responsible for the increase in the prevalent rate, poverty, malnutrition. You also have the advent of HIV that is so rampant now that we all know that HIV is an immunosuppressive disease, which also prompt people. An average of people living with HIV have the chances of 18 times chances of developing TB. So we all know other immunosuppressive diseases like diabetic, cancers and all that can also also predispose patients to have TB. We also have risk factors like alcohol, smoking, of tuberculosis, tobaccos have always been a high risk of developing TB.
Okay, thank you, Dr. Salawu. Now, staying with that, Africa has 25% of the global tuberculosis deaths. What can be done to reduce or arrest this worrying statistics?
Okay. As much as we know that the government has been trying their best to see increase in awareness, and one of the key points is for all health facilities to raise an awareness. And now the awareness has been upgoing. Access to facilities, public health facilities, should also be improved. And testing itself, awareness is expected that for every patient that comes on in the hospital or at any health facility at all, there should be high index of suspicious to screen for at least the minimum symptoms of cough should be rightly screened. Cough of more than 2 weeks, we need to just screen to have suspected susceptible people who will answer to few questions like cough more than 2 weeks, weight loss, chest pain, night sweat, fever. And then we should also intensify the testing. As we all know that testing is very, very important. Having had to do the gene expert, AFB, chest x-ray, but at the level of all facilities, basic screening tools has been provided to be able to ask awareness, increase testing, so people will early detection of TB is very, very important.
Thank you, Dr. Salawu. Now let's talk about this issue of multi-drug resistant tuberculosis. What exactly is it, and what can be done to prevent this? What are those in the public health space doing about this?
Yeah, multi-drug resistant TB is a form of TB that in which the bacteria no longer respond to treatment, especially no longer respond to treatment, the anti-TB treatment, especially the core two main important medications like the isoniazid and rifampicin. So whenever there is a resistance to these two major components of anti-TB, you tend to develop multi-drug resistance TB. And as we know that TB has been with us for a lot of decades, and there have been strains of resistance to these major anti-TB drugs. Yes, multi-drug resistance can develop. And as we know, there are these inappropriate use of drugs. A lot of times you see a lot of our clients or people abusing drugs, specifically prescription that are being floated up to failure in the aspect of diagnosis.